All right, very good. Well, welcome to our next topic of our cross-section, our sector collaboration track, track number 1. As a reminder, we have 2 other tracks going. You can see the topics and the very bottom, the ahc2021.com. If you go to that location, you can navigate between the different tracks. So we're going to talk next about powering through building critical infrastructure resilient. You know, the scenario about 30 days without electricity. And in my past, I actually deployed to a location that it was 45 days before all, basically the major customers were recovered. And I can tell you that it's not a good situation to be in. Our speakers are going to be Mary Lasky, chair of the InfraGard National Disaster Resilience Council, and John Hopkins Applied Physics Laboratory. Richard Krieg, PhD, editor of the Journal of Critical Infrastructure Policy, and David Winks, Chief Science Officer, Renewable Energy Aggregators. It's all yours.
Great, thank you. So I'm Mary Lasky, and it's very nice to be here, and I thank the All Hazard Consortium and Tom Moran for giving us this opportunity to talk about a new book that the InfraGard National Disaster Resilience Council has created called Powering Through Building Critical Infrastructure Resilience. And why did we do this? We did this because there are threats to our electric grid. First of all, you heard that Director Kolaski's talked about cyber attacks and pandemics. So there are a couple of things here on this list that he mentioned in this previous talk. And cyber attacks are with us everywhere. They are with this in January, the big solar winds has been a great concern. We're concerned because they're in our electric grid. And so that's one of the key elements. Physical attacks also happen. And how did that happen? In Metcalf station in California, several years ago, there was a physical attack with guns shooting out transformers. They missed the key transformer that would have taken down all of Silicon Valley. And so that is certainly a possibility. Another thing is pandemics. And you can say we've been really fortunate because we're on Zoom, we have electric power, and the electric power hasn't gone down in a pandemic. But that was because our electric utilities have managed it very well. They were very careful in being sure that the teams that were on site doing things didn't have contact with backup site teams. And so we've handled it very well. Another is earthquakes. And we think of earthquakes basically out in the West and what might happen there, but they are also happening. We've had one in the East, so it could be any part of the country could have an earthquake. Solar storms are another thing that can happen. And in December, on the 9th through the 11th, there was a solar storm. It wasn't really it wasn't advertised, but there were 2 nuclear power sites that went down because of that solar storm. One was in Arkansas, another was in Mississippi. And so you would think of a solar storm mainly affecting the northern part of the country, and here it is, the southern part of the country was affected by this. Radio frequency weapons are sometimes they're also called intentional electromagnetic interference, are weapons that could be used to have a directed energy pulse go against something like a data center or a substation of the electric power grid, etc. And then one of the worst kind of things that could happen would be an electromagnetic pulse or an EMP that would be caused by a nuclear weapon detonated over parts of the United States, or maybe most of them, taking out the electronics and our transformers. So we looked at, this is why we were looking at and building the book, Powering Through Building Critical Infrastructure Resilience. And we looked at the risk and we looked at the consequences of a combined things like a cyber attack and also physical attacks, or cyber attacks and also an EMP. So we've looked at several of those. Then we were looking at what happens to our critical infrastructure. And so we asked 3 questions. What happens to this critical infrastructure if the electric power is not available for at least 30 days? So we analyzed what would happen to a critical infrastructure. Then what can this critical infrastructure do to help the electric power get back up? So that was an interesting question for this. And the electric power side of it would be, how are they going to black start? And what can this critical infrastructure do to be more resilient? So the critical infrastructures that we looked at were electric power, and then communications. And it's interesting because of the interdependencies between these, that the electric power depends on the communications and cannot restart without good communications. And yet communications can't function if there's no electric power. Then we also looked at water and how critical water is to our very existence. And wastewater, if the electric power goes out and the wastewater can't move and can't do things, the pipes will freeze. And then it's like all of the pipes would turn to concrete kind of thing and would have to be replaced if it was a long-term outage and there was no electric power. Food and agriculture would become so dependent, and the supply chain for getting us food is really, we've seen that demonstrated in the pandemic. Transportation, the way that we get our goods to us. When we think about what if there's no electric power, what happens to the trains and their signals? What happens to the cars out on the highway if there's no signals? So a lot of the things are so interconnected. Healthcare and public health are another thing that we know are completely dependent on our electric power. Emergency management, chemical, information and operational technology. We looked at the information and operational technology as 2 separate kind of things to look at. We're all familiar with our information technology or our cyber world, but we're completely dependent on the operational technology for being sure that chemicals and our fuel and even our electric power operate. And then we were very fortunate because we were all, we are volunteers, that we had a nice volunteer say, oh, he'd like to put in some information about the National Guard, which helps us all. So the book was created by 22 authors, and some chapters had 1 author and some had many. But how did we do it? Well, each author or team worked on their particular topic and wrote their chapter, and then sent it to all of the other authors. And we all had a chance to review it. And then in conversations we did this all virtually because the authors were from all over the country, and we did it all virtually, not only in 2020, but definitely starting in 2018, 19, and 20. And so all of the rest of the authors had a chance to give comments to that author about their chapter, but knowing that they would also be having everybody review their chapter. So it was always done on constructive, helpful comments. And then you'd go back and make that change and let everybody see it again. One of the chapters actually on food, we redid 3 times to be sure that it really was up to snuff and what we wanted to have other people see. Then we had Appendix A, which is done by the INCOSE, which is the International Council on System Engineering. Their Critical Infrastructure Preparedness and Response Working Group did a primer. And in that primer, you can learn more about cyber attacks and how to do some modeling. And so that's helpful. There were 6 authors there, and then 1 author for Appendix B. So one of the things that I think is really important is that we have today 2 of our authors with us. We have Healthcare and Public Health and Pandemic Loss by Richard Krieg, and Wireless Communications and Changing in our Architecture by David Winks. Richard is the editor for the Journal for Critical Infrastructure Policy. He's a visiting professor at the Texas State University. He's the former president of the Horizon Foundation, which was created by Johns Hopkins University and was a $100 million philanthropy. He was in 2000, after 9/11, he created something called the Community Emergency Response Network in Howard County, Maryland. And he was the health commissioner in Chicago. He was the dean of policy and analysis and planning for the Metro Chicago Healthcare Council, with 102 hospitals and in 6 counties. David Winks is the chief scientist officer for renewable energy aggregators, the co-author of an interesting paper that has just been published in the Journal for Critical Infrastructure Policy, and that was building resilient and reliable electric grid communications. So, and he has a wide variety of experiences in wireless and digital communications and satellites in Europe and Africa and Asia, and working with DoD and microwave and radio and radar and electronic warfare. So I would like to turn it over to Rich now to talk to us about healthcare.
Thank you, Mary, and it's a pleasure to be with the All Hazards Consortium today. In my own career, in and out, I've had contact with many people from All Hazards Consortium, and they've always been very good connections and meetings where they've been. Mary, let's start with the first slide then. Thank you. Let me just say a few words about the Journal of Critical Infrastructure Policy. We gave birth to this thing this year in 2020. So we've had 2 issues. It's a new journal. It's a peer-reviewed journal. And we have about 25 people on our editorial board. Mary's one of them, but we have very good representation across the country in terms of specialists in various critical infrastructure sectors, representation from our national labs, et cetera. I put it there because if you look at the Policy Studies Organization website, it is free of charge as a digital publication, and you can go in there and read it. Secondly, it's meaningful for me to put it up because Bob Kolaski, in his very good presentation, at the very end talked about liking to be sort of in a sweet spot where there's been some anticipation of a major event and at least some preliminary planning and hopefully some resources to deal with it. In the case of the pandemic, having been in the healthcare and public health sector most of my life, I can tell you that, back in 2005 to 2008, the H5N1 virus was spreading through Asia. It started to go global. That virus had a 60% mortality rate. 6 out of 10 people would die if they contracted it. It petered out before it came to the United States. But in leading up to 2009, we had the H1N1 swine flu virus, which was a variant of the Spanish flu. And, you know, it wasn't as deadly as coronavirus, but still a lot of work occurred back then in terms of preparing for the big pandemic. In fact, many of the things that we do now in terms of crisis standards of care and a lot of the procedures that we're using now started during that period where there was so much concern in the sector. So I point this out because it was probably the most predictable, low probability, high impact event. And yet we were not prepared. And I, like everyone else, do best with hindsight. But it's a reminder that issues like electromagnetic pulse are very real. And if you look at the threat surface or profile, you have to come to that conclusion that we should be preparing for that. So please visit the journal. And for those who are writers, think about contributing. The guidelines are on the web. Next slide, please. I am going to today just briefly go through the healthcare public health sector now and give an overview. Then I'm going to turn towards the pandemic and then talk about the healthcare and public sector part of powering through. Obviously, to all of us, this is one of our largest sectors. If you look at those numbers from 2 years back, 1.6 trillion, about 18% of GDP. That's about the size of our COVID relief package. All the expenses for a year in our hospital system. There are over 6,000 registered hospitals. If you look towards the right, that map shows critical access hospitals, which I'm very interested in. Here in Texas, we have many of them. These are the smaller hospitals that primarily serve rural areas and are very much at risk for a variety of reasons, which I won't go into now. We also have about 1,800 hospitals in total representing rural areas, some beyond the smallest ones. We have 120 academic health centers, teaching hospitals, over 11,000 community health centers, and 44,000 outpatient care centers, which are growing. Many people just think of healthcare in the sector, but public health is a big and extraordinarily important part of this sector. There are about 2,800 local health departments. We have various other organizations like the Medical Reserve Corps, 520 healthcare coalitions funded through HHS. So it's a very large sector. It has unique characteristics relative to other countries, but as a sector, it is of critical importance to people's lives. And I think one of the things that will have to be done in the next number of years is to get out information about how electric power loss on an extended basis could affect the system. Because as I've said, the threats are all too real. Next slide, please. Let me go through 2 slides. I'll start with hospitals and then public health. In terms of lessons learned thus far in the pandemic, in addition to my public health department background, I also serve with the Center for Health Security at Johns Hopkins on something called the CommuniVax project, where we have teams on the ground in specific cities across the country looking at vaccine hesitancy and trying to very rapidly formulate some strategies in concert with local areas and local health departments. I would, in my view, and these are my view, first of all, I think there has to be a much higher sharing, two-way sharing of product information in terms of the supplies, and including pharmaceuticals, the supplies, the equipment, particularly PPE, that we rely on. We can no longer use just-in-time inventory for hospitals. Many hospitals will have a storage room, and they had some supplies, but but basically, as we all know, they were insufficient. ECRI is the agency, the certification agency that works with HHS. They have an office in the Far East, they have an office in Washington, but their finding was that about 70% of the N95 masks, which are produced in China, don't meet US federal standards. That's not well known, but it is known now, and it should behoove us to produce these types of materials, every type of PPE, and also other types of supplies that have to be used not just in pandemic situations, but in other types of disasters and emergencies. That really has not been the readiness posture of hospitals. In addition, the hospitals have to move from a cost basis to think about some of these low income, low probability, high impact events. And that really has to be taken seriously. Some hospitals look at community needs as a part of various programs, but this must be intensified. And I think hospitals are going to be ready and able to do this once they can take a breath and have a few months between the pandemic and the future. This includes staffing, and I use the phrase here, all hands on deck. And that is not just saying, well, if you have a pandemic, you've got to increase your staff by 10%, but really to have an active, flexible plan that takes into account how you're going to operate. How is it that, for example, nurses who have young children can show up at the hospital? How is it that you can schedule people so that you're maintaining their energy and their focus? Right now, it's awfully hard to do it, and we have, thousands of healthcare heroes out there who are giving it everything they have. But had this sort of planning occurred, it would have been smoother and it would have been easier for the staffs there. I really think that we have to look very carefully at staff morale and behavioral health services, not just for the pandemic, but a lot of burnout occurs in our facilities. It happens to medical students. It happens in terms of the amount of time that physicians and nurses spend with patients. A lot of hospitals, a lot of healthcare providers are doing this now. And I think there are going to be some good models to integrate that type of approach in healthcare facilities of all stripes. Very important in terms of family challenges and kind of looking at that on a holistic basis. Minimally, if hospital staffs and healthcare providers talk about these issues, that in itself becomes a support. And as I've said, there are some very good models in some of our best healthcare systems. Important infection prevention programs are needed. Classrooms, for example, may not have hand washers available. That's not just for the pandemic, but you really have to look at prevention and prevention programs and trying to avert hospitalization given the latest methods that are available. And finally, when we talk about vaccine hesitancy, there's something called Public Health 3.0. This is the blueprint for the future of public health. Planning on that, there are two prior iterations that started back in 2012. The National Academies, the American Public Health Association were part of that. But what Public Health 3.0 represents is where the field wants to go. And probably the most important part of that, and the one that's stressed the most, is that if public health is going to succeed, they have to involve the community in the thought work that occurs. So if you give me my next slide, I can say a few words about that. We have to have massive outreach to alert the public for a robust public health system. People don't understand, by and large, what health departments do. In Chicago, when I was health commissioner, we had about 7,000 restaurants. We had 60 health inspectors for those restaurants with a 2-visit-a-year schedule. I can talk to you for hours about that one issue, but health departments really are the place where 100 years ago, we developed all of the ways that communities use to avert disease from water, contamination, et cetera. And you can see there are lapses even in those things right now. There's been massive underinvestment in public health. Basically what happened was after 9/11, there was a huge drop in the level of funding for health departments. There was a shortage of, there was about 50,000 local health department workers were fired based on lack of funding. Much of the funds that went there had gone into the healthcare delivery system and other types of needs. The Millbank Fund has put out some reports about this, but there was a massive drop in funding levels. And what that's caused is really a patchwork system around states. States that have been able to supplement that have a really good public health system. And if you look at the map, you have some real issues. I kind of like that diversity. I could talk to you about West Virginia and why they have the highest vaccine rates, but some states have adopted well to that lack of resource. Most states have not. And they are understaffed when something like a pandemic comes along. I also think that based on technology change, I'd love to see the kinds of dashboards we're seeing now on the national scale get down to the local scale and use some of the models that exist to inform the community on health indicators. It'd be great for young people, for example, to look at the health indicators for their community, which are available, and even to help on some qualitative measures that they could put on the screen and assist in determining what are the needs. And then to empower communities to work in concert with health departments to do this. I've seen many examples in Chicago and the Midwest and other places where community involvement, despite some of the hiccups that can occur and some of the politics, really can make the life of those working in health departments be much more effective, much more fluid, and much more interesting. So I'm hoping that the lessons of Public Health 3.0 get put in after the pandemic and that we see an increase in funding to these vital departments around the country. And someone mentioned in Bob Kolaski's presentation about, or prior to that, I think Anthony Hurley mentioned this, but that in a show of hands, there were private people in the audience and public people, and they don't talk. And it's really essential that the healthcare delivery system, including hospitals, have a very robust partnership all over the country in terms of public health, healthcare delivery coordination, which is not at the level it needs to be, probably, if I guess, about the 50% level. Next slide. Thank you. So powering through. I can't say how strongly I feel about this, but we are totally unprepared for a long-term power outage in this field. You probably have all seen what happens when you have a long-term region-wide or national power outage, some of the representations that are out there. And basically, those who have been involved in tabletop exercises and some functional exercises, and I'll talk about one in a few minutes that I was involved in. After about 3 weeks, after about 4 weeks, society kind of breaks down. There's no health provision. It's kind of like the worst disaster you can imagine from a hurricane, but with less resources available to the infrastructure sectors. A long-term power loss is not included, at least I have not seen it in the DHS FY 2020 to 24 threat and their assessment or strategic plan, which the All Hazards Consortium is very aware of. In terms of modern hospitals, I point out here that about 1% of all commercial buildings are hospitals, but they consume 5.5% of building energy usage. That's obvious. They operate 24/7. They have diagnostic equipment. They have air conditioning, refrigeration. Hospital cannot function very long without electricity. Next slide. Thank you. Water is even a worse case. The President's National Infrastructure Advisory Council, which works with CISA, did an estimate of degradation in the 16 critical infrastructure sectors. in hospitals and healthcare was the worst case. After 2 hours, a hospital, that arrow you see on the left points to the healthcare sector. After 2 hours, a hospital has between 67 to 99% degradation in functioning based on the best available research and data. So hospitals are extraordinarily dependent on water. Water systems are extraordinarily dependent on electricity. We have some hospitals here in Texas where the town has a water tank with a gas-powered or electric-powered pump that pumps one day's water supply up into that Texas water tank that we all know, that iconic water tank. Without electricity, unless you've got a propane backup, and even there are problems, you're not going to have water in your hospital. So in chapter 7 of the book, we look at water deprivation in hospitals. We look at the impacts of electric loss and try to develop a modicum of planning and structure on how you approach that in both sides of the healthcare and public health sector. Next, please. One of the things that hopefully will happen, hospitals need high quality electric supply. They need 24/7 continuous electricity, life or death situations if you don't do that. And the approach that I believe and many believe needs to be taken is to have a major upsurge in microgrids where you can hook in renewable sources. It can be attached to the grid, but also islanded from the grid, and also protected against electromagnetic pulse so that it's survivable in the case of any sort of incident like a solar storm or other threat that could take down the electric grid itself. On the left side of this slide is a chart that was taken at Princeton Hospital. This is the Princeton University campus during Hurricane Sandy. And you probably can't read it, but basically what it shows is that when Sandy came through and the electric power system went down, all of the hospital's needs and all of the campus needs were met by the microgrid that they have operating there. So this really is a solution that hospitals have the capacity, the financing, the expertise, and so on to develop. Most hospitals have a 2-week supply of fuel for their generators. The report spends a considerable amount of time talking about the current situation with hospitals and why it is they have not moved more aggressively towards this type of solution. So this is something that I hope gets accelerated as the years go by. Next slide, please. One of the things that we have in the book is the fact that we might consider, and this isn't just my idea, but this comes out of a lot of good thinking, that if there was a power outage and we lost our healthcare delivery system, what would happen to continuity of government? What would happen to all of the societal functions that are important? And the thought here is that what should be explored is academic health centers, current ones, and perhaps some new ones that are built, that are EMP protected anchor hospitals around a broader system. There might be criteria that would require they be near a military base and near a state capital. But the thought here is that without healthcare delivery, we need to think about how to concentrate resources if and when the electric power goes out. And so this is one idea that I think should be looked at. There's a group at Johns Hopkins that have written about this. We had an article about this in our first journal issue, but the idea is to have this as a research and development capability, but also as a healthcare provider if the worst happens, so that in state capitals, near military bases, we have the ability to handle healthcare delivery on a limited basis and don't just have nothing. Next slide, please. I have two more slides. If an EMP happens, if we lose electric power for a long period of time and there's nothing, what happens? The chapter goes into how is it that you could set up survivable multidisciplinary health networks and resources at the local level so that communities could survive by providing basic health services, basic first aid services, and why that's desirable and what's out there now that could expand into this role. And reality testing was done with some of the 500 plus regional health coalitions. Some of those are led by hospitals, some by health departments. They're all funded by HHS. And the idea is that in exercises, but also in storage of resources and training and exercising, that we might be able to develop a skeletal type of community-based health provision if the worst happens, so that we can save some lives in that situation. Last slide. Next to last slide, I didn't realize that. So I list here some of the obstacles to investment in EMP resilience, and they are considerable, but they all come down to decision makers such as hospital CEOs and CFOs having to think about the resilience of their electric system and what they would need to do to invest in that, and whether that investment fits with their financial planning, and making the case for that. It's easiest when there is a hospital facility or a new hospital being put up because it's less costly there. But there is technology, and there are ways that hospitals can move into this, and some evidence that when you have very good power supply, where it's high quality electricity and it's not going to go down in any circumstance imaginable, that it's worthwhile in investing in that. And I think communities would insist on that if they realized how their local hospitals depended on water and electricity. Next slide. Finally, I'd like to end on an optimistic note, but as I've said, in those exercises I've been in, where first responders and emergency managers are presented with what happens in a severe solar storm or other type of EMP, and the power goes down for a long period of time, they really get it, and they do worry about it. We held a tabletop exercise about a year before Hurricane Harvey in the Harris County, Texas Emergency Response Office. And we presented a very accurate depiction of what would happen in a long-term power outage. We had the Coast Guard there, first responders, police, hospital representatives. And in the evaluation, which I was there to perform, they ranked it at about 97% important in the scales that we gave them in terms of other things that they might prepare for that were low probability, high impact. This long half-day program really allowed them to tease out what would happen. They looked at the threat information that was available. We had experts come in to do that. So when first responders and emergency managers understand what the probabilities actually are of a severe solar storm and other ways that the power grid can go down, they are very, very interested in learning more about that and incorporating that into their response planning. The other thing about this, and my last comment, is that although this happened in Texas, and although we have some legislators in Texas who would like to work here to develop a hardened electric grid, that just hasn't happened. In fact, two bills that went in before the Texas General Assembly that just called for a commission to look at this issue were not approved. We're not talking about putting money into hardening the grid or anything like that. There really was a lot of political opposition to that, even though most conservative groups in Texas came in behind that proposal. So a lot of work has to be done on a lot of fronts to gain resilience in the electric grid. And I think that Powering Through provides a lot of strategies across the whole publication. So I think I'll stop there, and thank you.
Thank you, Rich. And now we'll move on to David Winks. So David, take it away.
Thanks, Mary. First of all, it was a pleasure working with InfraGard and all the authors and putting together this book. And certainly we appreciate the All Hazards Consortium and the good work that they're doing. My task was to address communications, and why it was important to protect and harden the communications for things like the power grid and for the hospitals, and to make sure that all these things stay up and operational. So just to touch on a few basic concepts, we've all heard about 4G and 5G and different generations of cellular networks. So what's changing as we go forward here? Well, you'll notice that with 5G, you're seeing a lot of advertisements and things about more bandwidth and what you can do with it. And that's kind of related to how much data you can send through it. And as it turns out, when you're building cellular networks and connecting things together, the higher you go in frequency, the shorter it goes through the atmosphere, and consequently you have smaller cells. So you need lots and lots and lots of them, maybe 10 times as many or more as you go to the next generation of cellular network. Well, that means you have 10 times as many real estate issues, you have 10 times as many power issues of getting power to those places, and connectivity issues as well. One of the things that's happening is the movement of a lot of the functions that were in the core of these networks to the edge, because you have so much data, how do you know what to send where? And the best way to do it is to process it right out where it's occurring. And so you'll see a lot of that called edge data processing. You're also seeing a lot of that functionality of all these different functions that were once in maybe a single or a couple of places getting pushed out to the network edge as well. So we'll talk a little bit about what's changing physically in those sites, and then how do you protect it all? So let's go to the next slide, Mary. Some of the other things we'll touch on in terms of communications are satellites. You've probably seen a lot of information about Starlink and Kuiper and various OneWeb, and I think between all of them, they're supposed to put up somewhere between 10 and 30,000 satellites in low Earth orbit. And then you have the medium Earth orbit guys, SES and O3b, and then you have the geosynchronous satellites, the ones that stay in place over the Earth over long periods of time. And so some of the things that are changing are the antennas that we use and how strong the satellites are in terms of their signals. So the satellite antennas that we use are getting smaller and smaller. And a lot of the new ones are moving to what are called phased array antennas. So think about things the size of batteries that are all transmit receive elements. And you put them all together into a big flat plate, and now you have an active array antenna. Those are interesting, but they're also getting harder and harder to protect against a lot of threats, particularly electromagnetic ones. We'll touch on that here in a minute. Some of the other things that we're seeing in terms of communication platforms are aerostats, think blimps, with cell sites on them, and drones. A lot of emergency recovery by the major carriers will send drones with cell sites into an area to restore communications. And those can be lighter than aircraft. They can be drones that we normally think of, like little quadcopters, or drones with larger wingspans. And some of the key factors there are persistence and what area do they cover, and how much capacity can they handle. So let's go ahead and go to the next slide. Now, if we're going to protect the communication systems that are used by the grid and of course the rest of our society, they're made up of a bunch of different technologies. You have fiber optics that go to a lot of them. You have direct satellite connectivity, bringing back that information, maybe processing it in the cloud. You have microwave point-to-point links. You have a lot of carriers and communication facilities and electric utilities starting to use 4G and 5G cell phones, basically, in a fixed version to transmit data back about their power networks and the health of those. You also have radio base stations for dispatch, where you're going to send crews out in the field, and they have what are called special mobile radios. A lot of times these will be connected by the cables that you have for cable TV, like Comcast and other providers. And then you have copper circuits that are out there, what we would call plain old telephone service. And you have digital versions of that. They're a little higher bandwidth. So all of these things have supporting infrastructure that we need to worry about. So they have, industrial control systems, they have routers, they have Wi-Fi that occur in a lot of these cell sites. They have power generators, fuel cells, UPS systems, heating and air conditioning. They have switchgear. And then, of course, you have things like fuel trucks and fuel pumps and the big fuel stations that are needed to refuel a lot of the generators that run these in emergencies. So in terms of protecting all of these, there's some basic steps that we can do. Most of the sites that are built out there today are designed to be protected against lightning. And that's a great thing to protect against, but they're not designed to be protected against electromagnetic pulse, RF weapons, or solar storms. And so you design your grounding grids differently. You have wide, flat straps, for example, instead of round conductors. You have to shield things differently. Instead of having your equipment just sitting in a rack inside a little equipment hut, well, you need to put that in a shielded cabinet that's seam welded, that's nice and tight. And you have to do different things with your air vents, and you have to include the power supplies inside the cabinets, because if you have a generator sitting outside in one of those kind of an event, it may or may not make it. And so we've looked into all kinds of different fuel cells and Stirling engines. We've looked at solar thermal systems. We're a little concerned that the PV solar, the typical solar panels you see on somebody's roof, probably aren't going to make it through that kind of an event. We've also looked at different battery technologies, including the new solid state batteries and also hydropower systems. So you'll see a lot of that in this chapter, and of course discussed in the book. We also talk about EMP testing, and that's not something that's typically done today. We test for radio interference, for example, with equipment, but an EMP versus your regular AM radio station is about 1 million times stronger. It's like a tidal wave, coming over your house, as opposed to, somebody spraying it with a garden hose. So that kind of testing is really important to make sure that your equipment stays protected, and that has to be done periodically because, corrosion affects things like that. People drilling holes in things they shouldn't, to mount things, for example, would compromise that kind of protection. So the chapter in the book talks a lot about each of these things. And so I'd encourage you to pick up a copy and learn for yourself. And with that, I'll turn back over to Mary.
Thank you, David, and thank you, Rich, for talking about your particular chapters. And one of the things that I'm really the happiest about is that Tom Moran gave us a wonderful endorsement. Part of his endorsement is on the back of the book, and the whole endorsement which is over a page long, is in the front of the book. So the book is now out on Amazon. You can get it for the Kindle version. It's only $9.99. What a deal. And the paperback is also on Amazon now. And it is $69.95. So we would hope that you would consider buying this book. And so I'm going to now ask if there's any questions and maybe we can answer them. So
Yep.
Tony or...
Yeah, there is a great job, all three of you. Very informative. Thank you. There are a couple of questions. One of them is that how possible is a long-term, a 30 days plus wide power outage? How realistic is that, considering electric companies? And I'll just throw in here that, I know that when we were in the Virgin Islands in Puerto Rico, it took 45 days plus just to get a lot of the critical infrastructure back, and it was several months before power came back. But talk to us a little bit about that quote unquote 30-day scenario.
So one of the things, I'll just jump in on that first, and then we'll let David and Rich talk. But at the Applied Physics Lab at Johns Hopkins, we had a speaker who was the head of the cyber security. And I asked him offline, if it was a cyber attack on the grid, how long would it take to get back? And he said it would take us probably at least 2 months to get back. So that is one of those things that is, we see every day cyber attacks. And so if it would take, if there was a major attack on the grid, it could take us 2 months to get back. So that certainly says 30 days is not unreasonable. So David, anything that you want to add, or Rich?
I would say that probably the best probability estimate that exists that's science-based has to do with the so-called coronal mass ejection, solar storm activity, where the predictions indicate that we're overdue for having one. They look at various, what happens during decades and what the probabilities are there. There have been near misses in recent time where there's been an ejection. Earth just had passed by the trajectory of the solar storm. We are in the field of space weather. NDRC has discussed with various scientists there's mapping going on right now on the geomagnetic structure of the United States that shows the magnetic properties of the landforms. About, I think, Mary, half of the country's been done. But by looking at solar activity and this geomagnetic map, you could have predicted where the harm to the electric system has occurred. So there's a lot of work going on there. The main threat that you cannot quantify is that the grid is, it's a system of systems. There are other infrastructure systems that crosshatch with the electric grid. There are various legacy components that are quite old and less resilient. And, in some quarters, less interest in investing in this, as I indicated in my presentation, against other types of needs that exist. So the very complexity of the electric grid lends itself to breakdowns, and there have been national breakdowns where something as common as trees brushing against power lines in one state can hit an entire region, leading to millions and billions of dollars of loss. This has happened. So you have to look at the costs. David's been someone who's done some really fine work in that area, but try to take reasonable precautions that are scientifically based and also have side benefits for the economy in terms of workers who would make those changes as an infrastructure job category, and also make the electric system more efficient and effective.
Very good. We have another question. So when the EMP first came out, we all heard the scenario that a nuclear warhead explodes over the United States, and that's what a lot of people associate the EMP with. And that's what a lot of people thought it was right up until the time there was a movie made about taking an EMP in the middle of a major city and setting it off. It was inside of a van to knock all the lights out so they could rob a vault. So talk to us about the EMP threat.
I'm not an expert, but I've been reading about this and talking with experts about this for some time. In the so-called asymmetric warfare planning of a lot of countries, including Iran and North Korea, there has been there is strong indication that in the military doctrine of those countries, and they're quite open about this, causing an EMP from lofting a small nuclear device at a high altitude is part of their military doctrine. There's some indication, David mentioned geosynchronous satellite, but there are some people who believe that a Korean satellite above the United States may have that capacity based on evidence that was amassed. I cannot attest or not attest to that, but there is a satellite up there now. In addition, if you look at the Nuclear Threat Initiative, NTI in Washington, that is a very active organization that monitors the theft of nuclear materials around the world and does a very good job on that. The threat profile there is very strong in terms of nuclear material that's been stolen over the years. In Russia, for example, there's not the security that you would find. So that in the aggregate, and then you have, the possibilities of a terrorist event that would, the type of physical attack that Mary talked about, that might be planned and executed in terms of large transformers, some of which are, there's not advertising where they are, but there is a certain probability that electric substations or larger stations could be hit by a terrorist strike, thereby causing tremendous damage to the electric grid and electric supply. So when you look at the complexity of these systems, the fact that they're all interconnected, the fact that they're all susceptible to cyber attack, leads one to be, very concerned that basic steps should be taken and not look the other way and not try to set forth what needs to get done. Last thing I will say is there was a very good EMP commission that set up some years ago that really went through the steps, what the threat is and what needs to happen. And those directives, that guidance was never implemented. So going back to Bob Kolaski, here's another case where there's been a lot of work done and where some reasonable steps could be taken, but it's not on the drawing board at this juncture.
David, do you have something that you would like to add to that?
Well, I think, Rich touched on a couple of important points. The likelihood of that threat is increasing. North Korea may not be the only state that has satellites orbiting. All they have to do is deorbit to about 140 kilometers and detonate. So, they don't have to actually land a nuclear weapon on US soil. And that would take out the power grid for a long time. Estimates indicate that could be as long as a year. And so when we think about the likelihood of that going up, now you look at states like Iran and the likelihood of their having a nuclear weapon and their ability to put a satellite in orbit, and Pakistan and other folks that they're the tinder, the dry tinder of South Asia between Pakistan, India, China. There's an increasing likelihood of one of these events occurring.
So we really want everybody to get powering through building critical infrastructure resilience, because it gives such wonderful suggestions of things we can do to now start mitigating these potential effects if bad things happen. So.
Very good. Panelists, thank you very much. There are no other questions. Laura?
Right. Mary, David, Rich, thank you so much for your time today. Really appreciate it. Mary, thank you for your longtime support. Great to see you again.
Great to be here, and thank you for giving us this opportunity.
Of course. Okay, so for all of our listeners today, we're faced with a virtual break now. So again, if you want to stay in track 1 at 2:25, we will start back with Kathy Fulton and demand-oriented decision-making in supply-constrained environments. You can also go to track 2 for the Fleet Movement app, or track 3 with Persia Payne Hurley. So please go ahead and stretch your legs and refresh your water. I'll get some music on, and we'll see you back at 2:25.